record button. I'm sorry.
Oh, recording.
Okay, so now we're recording. Thank you.
Thank you.
So basically, for all of you lab guys, we won't need you for 3 weeks. And then by then, we're going to have our lab group sorted out. They are going to need a partner within their group, and that's kind of their patient. Everything that they build on, that's the person that they assess, that's the person that they document. With DocuCare, we're going to be doing something a little bit new. I'm going to let Sarah talk about that in a minute, but they're going to open a chart and they're going to submit each week, and we're going to give them prompts for what to submit. We're trying to get away from narrative charting because that's not the way they chart in the real world, and it's very tedious for us to grade. We're trying to do as much click box, the way they're going to chart in the real world. We're trying to do that as much as possible, which makes our life a little easier as well. But in order to do that, instead of having, like in the summer, we had 10 different lab documentations that got turned in separately. We're going to open one, assign the whatever's due that week, like let's say it's neuro or HE&T, and they're going to resubmit the same patient, which is their lab partner, each week, so that by the end they've got the idea, we haven't actually done this yet, the idea is that they will have a whole complete medical record by the end. One thing that we don't want them to do in lab is spend the entire time fiddling with the DocuCare and not practicing skills. And if you guys have worked with students enough, you know that that's a tendency. They get out the laptops and that's what you see them doing the whole time in lab. So we want to, we've all got to get access to it. You need to understand how to use it so that you can answer the questions that they're going to ask for how to use it. But that's kind of how lab will go. And then their lab documentation is due on Friday night. The quiz opens each week on Friday afternoon, and then it closes on Sunday. So that's at home, lockdown browser, 20 questions. We use a test bank of questions. I'm also adding in the newer next gen clinical judgment type questions. I'm not just going over to the entire new Jarvis set of questions because, to be honest, they're readily available on Quizlets online. You can just search Jarvis edition 9 and there's all the test questions. So I'm not using all of them. I'm just using a few. And I'm hoping that I'm switching it up enough that they're not able to know what's on the test before they come in. Let's look down here. Checkoffs are a little bit, I think I know how they're going to work. I'll be able to tell you a lot more when we get closer to time. I would like for them to have a checkoff assignment, an appointment for within their regular lab time. If they always come on Thursdays at 8 a.m., I would like for them to be somewhere between 8 and 10. There's going to be 20 students in the assessment lab, each group, and 2 faculty. So if you could try to grade 10 labs for each group that you proctor or assist with. So for each of us, I think that should, except for Shavandra, because she's not in a lab, that should be 20 for each of us. No, so it'd be 20 for me. 10 for each group that you are in their lab. Does that make sense? If it doesn't, we'll clarify it when we get there. So we'll have general assessment, integumentary, and then we have their first checkoff, which is basically a vital signs checkoff. They're going to measure height and weight and calculate BMI. They're going to do a mini mental status exam. They're going to do a set of vitals. And it seems so simple, but that one is really, really stressful for them. And it takes kind of all hands on deck for checkoffs. So if you have availability to come for a lab that you're not assigned, please let me know. But I'll be putting something out in a few weeks once we all get started asking for help with the checkoffs. And honestly, everybody always helps out. Sometimes even grad students come help out with checkoffs, which is, super helpful, and the students respond well to that. That week, they'll also have their health history and genogram due. Their respiratory, cardiovascular. I wanted to get down here to the end. I'm not sure that this is done yet, but I was trying to accommodate Shavandra and Abby both had days that they needed to be off. And, with Shavandra, I can't just, we might be able to, but I think I've got it where we don't need to have somebody come lecture for her. It would be a lot easier to have somebody cover lab for Abby than it would be to have somebody come lecture for Shavandra. So this is kind of how I have the end of it sorted out. Integrated is where we kind of put it all together. The next thing is open lab and then the final checkoff. So right now I have us with no class and no lab the week before Thanksgiving. Unfortunately, that gives them 2 weeks off, but they already have their head to toe choreography ready to go and ready to practice for that 2 weeks that they're off. And they also should be starting on the final. So at that point, all of their content is done. One thing I'm not sure about with this week right here is campus closed for Veterans Day on that day, the 10th? If it is, I'm going to have those people come to lab on the next week. So it wouldn't matter that Dr. Huggins needs to be out, because all we would need is someone for lab. Then after Thanksgiving break, we're winding up. Open lab, which is basically they just come in and practice whatever skills that they need to practice. And it's super important that we give them good feedback so that they're not practicing things the wrong way and then come and get surprised for their checkoffs. And then the final checkoff is the next week. That'll be a big calendar sign up. Again, kind of all hands on deck. And you closer to time, you'll have a much better idea of what we want that final checkoff to look like. And then there is a cumulative final exam in this course that's worth 20% of their grade. So I will be sending you the syllabus and schedule. And then once you have access to these Canvas courses, you can look at all of it. You can look at the PowerPoints, you can look at all of our the announcements that we make. And then I think the team's idea, I think I'm probably going to go with that, because that might be a way that we can all just easily communicate with each other if everybody's amenable. The Sim Center, everything's going to be at the Sim Center. I don't know if you guys have been there yet. Parking is free. I don't have room numbers yet. I do know where the health assessment lab is. It's basically a big room with 10 PT tables, a bedside table, some partitions. It's not going to be the level of privacy that they're used to. We usually have wraparound curtains, but we're just going to do the best that we can. If you've all taught health assessment before, you know that sometimes there are issues when you need to put stethoscope to skin. Sometimes, we want to honor our students, dignity and not, expose them, but at the same time, they have to learn their assessment skills. So we just do the best that we can with that. We have the girls wear sports bras, or anyone who has breasts or wants to cover them, wear sports bras with a loose top over it so that the students can do their correct placement for respiratory and cardiac sounds. Musculoskeletal, and I should go back. Fundamentals does uniforms for lab and for checkoffs. In health assessment, we do not. They wear pretty much athletic clothes or whatever they're comfortable in. We need to be able to get to their pulses. We need to be able to get their sleeve up to do their blood pressure. It's really, they wind up wearing athletic clothes, which is absolutely fine. Parking is free. I said that. I think I've covered it all. Sarah, can you give us like a little bit of info about DocuCare?
Sure, and I made a little note too, for genograms. If you have another didactic course, you might want to be careful that nothing else is due the same time. It's just your genogram requires some hours for grading. So just, that's my only tip for that. Okay, so DocuCare. Yes, I'm putting together a little video to walk you through what it will look like grading student documentation. And I've written a little email. Just want to make sure that hasn't been, Judy or Dr. Como hasn't sent off any email with you CC'd on it to Lippincott. Have you been CC'd in any email? No. Okay.
And even
okay.
you and I will have to be looped in for a new course.
Actually, I did want to ask a quick question about that. So I was trying to get.
Oh, Shavandra, I can't hear you. I'm sorry.
This is Shavandra. And any better? Any better? Any better?
A little better.
Better? Any better?
Yes.
Okay. See, yeah, my new townhouse doesn't have internet yet, and so the signal's not the best here. So I'm trying to get access to the textbook, and I have two different emails. One from a Jared Ross who's asking, do I have an account with Evolve Elsevier, which I believe I do through UF, but not necessarily for health assessment. But then the other question someone else emailed asking was a Brian Rincor, he wanted to know, do we use, about SurePath. Do we use SurePath?
No,
Vantage. Okay, okay. Well then I guess that's it. Are we using
that sounds
ebooks?
like that might have been a salesperson trying to get in with you on the short path. Jared is our Elsevier rep, and let him know that you need a new account, because I'm not sure that your UF account is going to access the things that you need to access. And then he is the person who, they did the whole pitch for us for SurePath. And of course I wasn't in on that decision, but they decided not to do it. So I think the other guy is probably just another salesperson that's trying to get access to you. So
Understood. Okay, got it. So I just need Elsevier access, and then and basically that's it. Like, do I need access to the ebook? Do the students use ebooks or archive?
Elsevier will get you access to the ebook, the instructor resources, the HESI EAQ, all of that stuff is going to be on Elsevier. So everybody will have an electronic text. Whoever wants a desk copy, let's get that as well. Judy told me just now on text that she has 2. So let me know if you want a hard copy of the textbook. And Jared is the person that can get it, but we have 2 already.
How do we get that Elsevier account, Amy?
They've got to add you to it.
Okay.
And if you have an N number, they should be able to add you. So that was another thing that I wanted to do, is make a little like housekeeping list of things that I need to follow up on for you guys. So let's get everybody Elsevier, Lippincott.
And Amy, I have the Lippincott email already written, so I have you CC'd on it. I just want to, I'll just hit send if that's okay with you.
Yes, for sure. Like, we need you guys to have access for Elsevier Evolve, Lippincott, and DocuCare. And it's okay if that takes a couple of weeks to get that. Lippincott is used mainly by fundamentals, but we, as a way to encourage them to pre-read and prepare for class, we offer extra credit for the assessment videos that they already paid for, so they're not having to pay for anything new. But it's videos, health assessment videos on Lippincott. If they watch those ahead of class, they get extra credit. And Shavandra and I can talk about what we think is good to offer. The students in general do really well in this class. It is a challenging course, but they do know exactly what's expected. So if they put in the work, they get the A. The cumulative final, however, is daunting for them. I feel like I go through it with a fine-tooth comb every single semester. I never just let it ride on what I gave the last semester, because each cohort's a little bit different. I want to make sure they got what they needed. They're still just absolutely verklempt over this final. So offering them extra credit kind of helps. I think anytime you have a cumulative final, they don't do as well as you would like for them to do. So, but we can talk about how much extra credit we want to offer for that. And as far as like the syllabus, like how they're graded, what the percentages are, I'm just going to send all that to you guys, and you can look at it on your own time. I don't need to read you the syllabus, but I did want to go over the schedule just because it kind of matters for everybody.
So I'll send you the email for DocuCare with the video probably today or tomorrow. And then you'll watch it when you get access. You can play with it. And I'll just break everything down in that video.
Thank you so much, Sarah.
My pleasure.
So who does not have a functioning N number?
Me.
Okay.
It's Richard.
So I have an N number because I was a student. I think I tried Saturday to see if I could get on Canvas with it, and I don't think I could. Yeah. But like, I can log into My Wings. I think it converted to faculty on My Wings. I'm not sure, but I mean, I have my number I can give you. I don't know if you want to try it.
I can reach you. I just was trying to figure out who, like, because I've been looking for you guys in my UNF Outlook to see if I could add you to these courses so that you can see all of this. And so far, I haven't been able to add everybody yet. But I'm going to keep trying. And then, okay, so we talked about lab groups. I don't have room numbers yet. We're going to do a Teams. We don't need you for 3 weeks if you're doing Oh, Shavandra, I know what I wanted to tell you. This past summer, we got a new text, new PowerPoints. And I went through them each week, but then, you know, when you deliver a lecture, it's a little bit different than when you're going through it in your head. And they still have too many words on the slide. It still needs to be pared down a little bit. So I don't have enough time to do all of them before class starts. I'm going to do them as I go. But if you would like for me to send you like revised PowerPoints, I can. But what you have in that Canvas course now that your name is assigned to is basically copied over directly from my course. So it's the same. Dates are the same. You'll need to switch out your syllabus and with your name on it and all that stuff. Okay. And then if anybody, I really would love for, and that's one of the reasons I'd like to have the team, if anybody has input, hey, I think that we could do this better in the lab, or this is something I'm noticing that the students are doing. One of my main concerns, the most students I've ever had since I've been here was 83. And it's a little different. Like I had 42 in the summer, you know, so I want to try as best we can to maintain our quality, even though it's ×4. So whatever you see, like make sure that we know what you see and that we're all on the same page with it. Like, oh, hey, I don't think the students really got this. Can we reinforce this? Or this is something I'm seeing in lab. Okay.
Okay.
So Shavandra and I will hit the ground running next Wednesday. I would love it. This is a huge ask and please do not feel obligated, but I would love to introduce the students to any of you that are around next Wednesday. Just so that they know who you are before they come in to see you to lab. And if not the first Wednesday, maybe the next Wednesday. But if you could just like pop in, you don't even have to tell me what time. I can just pause and introduce you to the students.
Hey, I'm helping funds next week. I'll do it the following week.
Okay.
Yeah, the 31st, the 30th.
Awesome.
Perfect.
And then don't worry if you can't, because there'll be somebody there that can, you know, let you know where to go, what to do. And then we just hit the ground running. Any questions, anything you could think of that I didn't cover that you were really hoping I would? No, I know Bambi, you need some Canvas help.
Yeah.
Yes.
I don't know what it is I need to ask. So
And as I also wanted to show you just real quickly, you're still seeing my screen, right?
yes.
Yes.
So somebody was asking what is Banner, and Banner is kind of like they're actually about to change it to something else, but I wanted to show you where you can look for this information yourself once you have MyWings access. If this is under faculty services, there's also employee services, which you can look up your pay and your retirement and your timesheet and all that stuff. But under faculty services, you can go to faculty detail schedule. And this is just me because I'm a little extra. But I can look at this class list. I haven't added the syllabus yet because I really want a room number, but this is one of my sections. I can go to the class list and then I can scroll down, and this is all the students that are registered. But I really like this photo roster.
Oh, wow.
This
wow.
is,
Nice.
so I'm glad you guys think that's helpful too, because one thing I like to learn their names soon. And sometimes that's a little harder than others. This really helps me to kind of get an idea of who are these students before I see them. It also helps me maybe try to see if I'm going to have trouble pronouncing their name. So I just wanted to show you where that was so that you can see who you're assigned to. And then I wanted to go back because if I go to, so this is health assessment. This is, so my course, and it has Sarah on here for lab. It'll also have Richard Weaver on here. This second one is Shavandra's, and it has Abby and me assigned for lab. And then me and Sarah, Richard, I don't know why you're not on here, but I know that's where you are. And then, so like Bambi, Bougainvillea, that's a beautiful name. So this will be your section.
Okay.
So like, this is the one that I'm going to add you to, that you'll be able to see your students. You'll be able to put in grades for them. Okay. But that's when I'm talking about Banner, that's Banner. And then Canvas, of course, is this. And I can definitely help you with Canvas once you get access. Okay. Does everybody feel like they know what to do, where to go, where to be, or at least know what we don't know? All right. Well, Sarah, unless you have anything else, I'm gonna let everybody go.
No, well, everybody has email except for, is that right? Bambi, Shavandra, and Abby, you all have email from UNF, is that right?
Yes, I do.
Okay. That's all I needed to know. Thank you.
Okay, and I'll go ahead and make a Teams and send it out. Okay. Thank you guys so much. I'm so looking forward to it. It's such an important course, and we're just so grateful to have all this expertise to help the students. Be sure and let me know if there's anything onboarding wise. I've only got control over so much, but I'm happy to help with anything that you have questions about.
Okay, great.
And so text access, we'll get that next. Does anybody know for sure they want a physical desk copy?
Do we need one as lab instructors?
You know, I was thinking about keeping mine in the lab so that whoever is there, because you know, the students like to like pick things apart. Like, well, you said this, but the textbook says this. You do need to be able to access the text. That was one of the reasons why we redid the PowerPoints, was to make the PowerPoints, the quizzes, and the lab all kind of marry up a little better. But I'm thinking about just having mine. I'll put my name on it, but I'll keep it in the lab so that whoever is teaching in the lab that day can quickly open up that particular chapter and get an answer if there's a question.
And if we want an ebook access, we need to have an account, you said, with Elsevier?
Elsevier, yep, and that's Jared Ross.
I actually have one.
Do we need to contact him ourselves?
I think what I'm probably going to do is send him an email and CC Judy Como and put all of the health assessment team emails on there and just let them know these are the people who need access to the ebook.
Okay.
And then if you want a physical copy, Judy has 2.
Okay.
But I'm just going to plan on keeping mine in the lab.
A quick question. With the books, does the publisher have extra resources for the teachers to use? You mentioned like PowerPoints. Do they actually have like PowerPoints they already created?
Yeah,
that we
so
can
under
edit?
the instructor resources, there are unfolding case studies, which I've definitely used at the end of lecture when we have a little extra time. Students love those. There are PowerPoints, there are quiz questions, there are all kinds of extra resources. You're gonna love that.
Okay, but to get those, we need an account first.
Yes,
Okay.
and it needs to have the instructor resources, because there's been times like when I was brand new, I got access to the ebook, but I didn't have the extra stuff.
Yeah.
Okay.
So
And this person, Jared, would be the one to help us once you've created the account for us?
well, he'll send you an email for you to create the account.
Oh, okay, okay.
Yes, and his name is Jared Ross.
Jared
And
Ross.
the Lippincott stuff will actually, that's Dave Levy. Don't want you to worry too much about everybody right now, but that will come from Cora. She'll get the students into the Lippincott, and then she's just going to give us, we basically make a new course that's tagged onto that course in order to let them get graded for watching those videos.
Okay.
And if they don't watch the videos ahead of class, it doesn't hurt anything. They just don't get extra credit on the final.
Amy, if you're like me, I'm going to be doing the graduate health assessment. Do I need to ask him to allow me access to all of the classes that I'm going to be a part of, or is that
if they use an Elsevier text?
They do.
Okay, then yeah, you need both of those for sure.
Okay. Okay.
Yeah. And then once you get going, let me know if your students want to help with checkoffs.
Okay.
So anybody have any other questions? No, I really appreciate you guys meeting with us. I'm looking forward to working with you. Be sure and shoot me an email, or my cell phone is on my signature for Outlook. You're welcome to text as well.
Thank you so much.
Okay, thank you.
Thank you.
I'll see
Thank you,
soon.
guys.
Thank you.